I'm having a sore throat and my body feels so weak right now. Maybe I'm affected by the COVID-19. I should have done the social distancing back then. Since the outbreak of the deadly virus, namely COVID-19, had been spread all over the world, we were obligated to stay at home or doing social distancing while we were outside in order to minimize spreading of the virus. But today, our main topic is the importance of social distancing. Next, my friends will take over to talk further the importance of social distancing. Well then, let's get into it.
My name is Nova Ashike binti Abdul Hadi. My topic of the speech is social distance. Social distance, more appropriately called physical distance, is not very straightforward, and if you are sometimes you sure you are not alone. Even though I have experience working in the infectious disease prevention and control, I too face moments of indecision translating and what I know about social distance into daily life. Social distancing is a critical measure to prevent the spread of infectious diseases, especially those that are transmitted through respiratory droplets. By maintaining physical distance from others, individuals reduce the risk of coming into contact with the virus. Many contagious diseases, including respiratory viruses like COVID-19, spread through close contact with infected individuals. Social distance helps break the chain of transmission by minimizing direct person-to-person interaction. Social distance helps protect essential workers who cannot work from home and need to continue provide career service. By reduce overall transmission rate, it lessens the workers face in their daily tasks. Social distance emphasizes individual and community responsibility in the managing public health crisis. It encourages people to take action that not only protect themselves but also contribute the well-being of the broader community. Social distance campaign raise public awareness about the importance of personal hygiene, respiratory hygiene, and responsible behavior during outbreak. Educating the public is the key of the component of effective disease control.
One way of limiting the spread of an infectious disease, for instance COVID-19, is to practice social distancing. This is not a new concept, as most societies have been aware of the value of keeping away from people who are suffering from an infection for many generations. The importance of social distance, it is an action taken to minimize contact with other individuals. It has been suggested maintaining a distance of 2 meters from another individual result in a marked reduction in transmission of most flu virus strains, including COVID-19. In practice, this means that avoiding close proximity to other people will aid in slowing the spread of infectious diseases. Social distancing is one of the infection control actions that can stop or slow down the spread of a highly contagious disease. If we follow social distancing, the virus that causes COVID-19 is currently spreading easily from person to person. When a healthy person comes into contact with respiratory droplets from cough or sneezes of an infected person, they can catch the infection. The World Health Organization, that is WHO, states that COVID-19 is transmitted via droplets and vomitus during close unprotected contact between an infector and infectee. A vomity is an object or material which is likely to carry infection, such as clothes, utensils, and furniture. Thank you.
Thank you, Pamela, for the explanation. Now, I will continue with the explanation regarding this topic. Why we should practice social distancing? Government representatives and public health specialists urgently advise people and families to keep their distance from one another. Aubrey Gordon, an associate professor of epidemiology at the University of Michigan's Schools of Public Health, says that social distancing is putting into place public health measures that are designed to reduce contact between people. These measures may include things like cancelling events, limiting the size of gatherings, closing schools and universities, asking employees that can work from home, and close non-essential businesses. social distancing for COVID-19 disease is able to protect us, our loved one, medical personnel, and help prevent hospital and intensive care units from being overcrowded. Due to the fact that many COVID-19 cases are asymptomatic or pre-symptomatic, social distancing can protect high-risk population including the elderly, persons with diabetes, obesity, heart and lungs problems, and people with the weak immune system. When infected with an unusual coronavirus, some individuals merely suffer from slight illness, while others do not. Social distancing is one preventive technique that can shield vulnerable individuals from more severe illnesses. Besides, when the epidemic is spreading, the ministry asked all schools and universities to close, but learning still continued by introducing distance learning. So, as a student, we were faced with forced social distance (FSD), which caused us to have open distance learning (ODL). The idea was to promote social distance. At first, it was initially skeptical, but ODL can offer a lot of incentive for both students and the lecturers. It has advantage, especially during the pandemic. ODL make it easy to meet the demand for lecturers and students to maintain social distance. Both groups are kept in their houses where there is no chance of infection or contact with other people. Additionally, parents had new opportunities to get to know their children and assist them learn during the pandemic. The pandemic allowed them a better understanding of their child's learning styles, needs, or curriculum. So, that's my explanation. Next, Balkis will explain her point of view. Thank you.
Thank you so much, Aida. Hi, my name is Balkis. I do agree with Aida's statement. COVID-19 has taken over a lot of people's life. Social distancing needs to be practiced by society in contributing the rate of infected people, but somehow there are still more people who are irresponsible. This brings up some effects towards society, especially increasing infection. The risk of infection will be getting higher and dangerous because it can cause of death. Besides, overwhelming healthcare of hospital. This happened when the need of medical service was rising because of the rapidly increasing rate of people who get infected with COVID-19. When the amount of supplies exceed their need, the hospital has a shortage of resources. The patient needs beds and they require a lot of medical care, admission and workers' capacity. Moreover, the amount of healthcare medical workforce that have to face stress and burnout in mental and physical during extended working hours. They have to take care of hundreds of infected patients every day with a lot of emotions that influence their working function. Thank you very much. That is the end of the thesis argument. Now I will let Anis to proceed her part.
Thank you, Balkis. Based on the thesis argument, I agree that without having a social distancing, we are agree to the following, which is explaining more due to the attitude of people who do not care about government address. Because of our distancing attitude towards these issues, we might lose our own environment. Without social distancing, we can cause the virus to spread without knowing it. We are still learning more and more about coronavirus every single day. But public health officials continue to warn that we don't have to everything in touch to spread the new coronavirus. The perspective of the virus can be contagious as the light is 3 days before he or she develops various symptoms. In addition, some people never develop symptoms, but are still able to spread the virus. This means that even if we feel fine, we can still use our virus to spread the virus if we are infected and don't yet know it. Without having a social distancing also, we will spread the virus for person to person. And now, you are familiar with how the virus spreads. If you are infected on top, we will show evidence it, you will potentially spread the virus to someone that is nearby. When you will allow a person to perspective, it's important to understand that a person can infect more than just one other person. In fact, on average, infected individuals spread the new coronavirus to 2 to 3 people. And given the right conditions, 3 infected persons can spread the virus more than 3 people. For instance, the CDC report analyzing communities, in Chicago, we now found that a single individual in contact a cluster of 68 COVID-19 cases after attending 2 extended meetings of violence and other properties. Unfortunately, this cluster of cases is not taken easy. So, that's my point. Now, I pass to Nadia to conclude our topic. Thank you.
Thank you to Awanis with such a great info. As my friends had explained everything about the importance of social distancing, so Make sure to do social distancing after this in order to prevent the virus from spreading too much and aid for a better world. I hope we can survive in this outbreak together without losing anyone. I feel very dejected whenever there is someone out there fighting the virus with the untold chances to live. It is such an unavoidable tragedy for us. So, let's fight this together by helping with each other and do not lose hope. Let's social distancing. Remember our slogan, kita jaga kita. Thank you for listening.